In a shocking turn of events, the medical team at a prominent Los Angeles hospital has refused to provide treatment to a patient identified only as JK, citing concerns that the situation is too dangerous. This unprecedented move has left many questioning the circumstances that could lead to such a decision and the ethical implications involved. According to reports, JK arrived at the hospital's emergency department exhibiting severe symptoms that required immediate medical attention. However, after a preliminary assessment, the medical team determined that proceeding with treatment posed significant risks. The specifics of these risks have not been disclosed, leading to widespread speculation and concern. Under the Emergency Medical Treatment and Labor Act, EMTLA, hospitals in the United States are mandated to provide an appropriate medical screening examination to anyone seeking treatment for a potential emergency medical condition. If such a condition is identified, the hospital is required to either stabilize the patient or facilitate an appropriate transfer to another facility. This law aims to prevent hospitals from refusing care based on factors such as insurance status or ability to pay. The refusal to treat JK raises questions about the application of EMTLA and the circumstances under which a hospital can justifiably decline care. Legal experts suggest that if a patient's condition presents a direct threat to the safety of medical staff or other patients, the hospital may have grounds to refuse treatment. However, such decisions must be carefully weighed against ethical obligations to provide care. The news of the hospital's refusal to treat JK has elicited strong reactions from the community. Many express empathy for JK, who, in a vulnerable state, was denied care. Others are concerned about the precedent this sets and the potential implications for patients with complex or high-risk conditions. Healthcare professionals emphasize the importance of balancing safety with the duty to provide care. They acknowledge that while certain situations may pose risks, the primary mission of medical institutions is to treat those in need. This incident underscores the complexities that healthcare providers face when navigating the intersection of patient care, safety, and legal obligations. It highlights the need for clear guidelines and robust support systems to assist medical teams in making difficult decisions. As the situation develops, it serves as a poignant reminder of the challenges inherent in the medical field and the critical importance of compassion, ethics, and diligence in patient care. Was this a case of medical negligence, or was JK truly too dangerous to be treated? The shocking decision by LA Hospital's medical team to refuse treatment has left the public divided, with unanswered questions and emotions running high. But what if the truth is far more complex than anyone imagined? JK's arrival at the hospital was anything but ordinary. According to witnesses, emergency responders rushed him into the ER under strict security protocols. Eyewitnesses describe hospital staff acting with an unusual sense of urgency, but also caution. Some even reported seeing personnel donning extra protective gear, hinting at a potential biohazard risk. Rumors began swirling almost immediately. Was JK suffering from a highly contagious disease? Had he been exposed to a dangerous toxin? Or was there another reason, one that the hospital couldn't disclose? While patient confidentiality laws prevent hospitals from revealing JK's exact condition, sources close to the situation suggest that the refusal to treat him may have been due to concerns over public safety. If we had treated him, the risk would not have been limited to just our staff. It could have been catastrophic, said an anonymous hospital insider. This statement only raises more questions. What exactly made JK's case so perilous? And if he was so dangerous, why was he not transferred to a specialized facility equipped to handle high-risk patients? Medical ethics dictate that all patients should receive care, regardless of their condition. However, there are rare cases where treating a patient could endanger others. Could this be one of those cases? One possible explanation is that JK posed a direct threat, not because of his medical condition, but because of something else entirely. Some unverified reports suggest that JK may have been involved in an incident prior to arriving at the hospital that put staff at risk. Some of us had to make a very difficult decision, said another hospital worker. The hospital isn't just responsible for one person. We have hundreds of patients and staff to think about. The public outcry following the hospital's decision has been intense. Protesters have gathered outside the facility, demanding an explanation. Social media has exploded with theories, accusations, and demands for transparency. How can a hospital, whose sole purpose is to save lives, refuse treatment to someone in need? Asked one protester. If they can deny him, who's next? Others, however, believe the hospital acted responsibly. If they had to make that choice, it must have been for a good reason, wrote one commenter online. We need to trust our medical professionals. The case of JK has ignited a national debate over hospital protocols, emergency response ethics, and the rights of patients versus the safety of healthcare workers. If a hospital can refuse treatment to a patient deemed too dangerous, what safeguards exist to ensure this power is not misused? Legal experts are now calling for a full review of the case, with some suggesting that the hospital may have violated federal law by refusing treatment. Others argue that this incident could set a precedent for how hospitals handle extreme cases in the future. As of now, JK's whereabouts remain unknown. Some reports suggest that he was transferred to a secret medical facility, while others claim he was simply left untreated and discharged. Whatever the truth may be, one fact remains: the world is watching, and the questions are far from over. Could it be that the hospital made the right decision? Or did they just condemn a patient to an unknown fate? Until more information comes to light, the mystery of JK will continue to haunt those seeking answers. Could this be a case of medical ethics gone wrong, or was LA Hospital protecting itself from something far more sinister? As the story of JK's rejection unfolds, new details are emerging, details that could change everything we thought we knew. But the biggest question remains: it was supposed to be a normal evening at LA Hospital's emergency room until the doors burst open and a team of paramedics rushed in with JK. What happened in those first few minutes remains unclear, but security footage reportedly shows hospital staff immediately moving away from the patient, some even stepping back in fear. Hospital sources claim that within moments of assessing JK, doctors and nurses exchanged uneasy glances. One medical professional reportedly shook their head and whispered, then came the unthinkable. The head physician on duty made the call: JK would not receive medical treatment. This decision, shocking as it was, might have remained a private hospital matter if not for a whistleblower who came forward anonymously. According to this source, the reason for the hospital's refusal had nothing to do with medical safety, but something much deeper, something they are desperately trying to keep quiet. I've worked in hospitals for years, the source stated. I've seen cases involving biohazards, violent patients, even classified government transfers. But this was different. There was something about JK that made the doctors afraid to even touch him. Was JK carrying an unknown pathogen? Had he been exposed to an experimental substance? Or was he involved in something the public was never supposed to know about? In the days following the incident, official statements from the hospital have been vague at best. At first, they denied outright that they refused treatment. Then, as media pressure mounted, they issued a carefully worded statement. What's even stranger, reporters attempting to reach them found that their social media profiles had been deleted, their families refusing to comment. One journalist who attempted to investigate their whereabouts was warned by an anonymous caller to drop the story. What were they trying to hide? As public frustration grows, theories have emerged about what really happened that night. Some believe JK was part of a government experiment gone wrong, one that made him too hazardous to be around others. Others claim he was involved in a crime so severe that even medical professionals refused to treat him. A particularly chilling theory suggests that JK was exposed to a highly classified substance, one with effects so unpredictable that doctors couldn't risk even attempting to stabilize him. And then there are those who believe JK is no longer in civilian hands at all. One anonymous tip suggested that after being turned away from the hospital, JK was taken by a shadowy agency that operates outside public knowledge. We may never see him again, the tipster warned. For many, this case has sparked fear that hospitals might begin refusing treatment under vague justifications, fear that some lives are deemed less worthy of care than others. Others are outraged, demanding to know why a man in need was cast aside. Whatever the reason, said a concerned citizen at a protest outside the hospital, if a human being walks into a hospital for help, they should get help. No exceptions. Yet, there are those who defend the hospital's actions.